As opioid death toll worsens, California doctors will soon be required to perform database checks. By the time the 59-year-old woman overdosed in the late summer 2013, she'd been given 75 prescriptions by 3 primary doctors, a psychiatrist, and a pain specialist in 1 year. Her deadly cocktail: an opioid, painkiller, a sleeping aid, and anti-anxiety medication. Had any of the 5 physicians treating her been aware she'd been shopping around for her prescriptions? Had they warned her of the dangerous combinations? Had anyone tried to intervene? For decades, California has kept a prescription history database for doctors and pharmacies to consult, but many healthcare providers have ignored it and the potential life-saving clues it provides. Why did they ignore it? Well, because there's money and there's an incentive in just prescribing. That's the corruption of Big Pharma that we talk about on a regular basis on this show. So beginning on October 2nd, a new law makes consulting that database mandatory. By logging into a web-based program, prescribing physicians should be able to easily spot signs of a doctor shopper, someone who sees multiple doctors to load up on prescription drugs or indications of dangerous medication combinations. I find it interesting that we're saying it's all the patient's fault. I do find it interesting that this article is hinting at it's all the patient's fault. First of all, this is something physicians should all do. There should not be a law requiring this. This is something every physician should do. When you prescribe something to somebody, you should see their medical history. You should look at it. You should consult them. You should ask them. California created the first system to track prescriptions of the strongest painkillers, but our state fell behind as the opioid crisis grew. I wrote SB 482. This is Ricardo Lara, the Democrat who wrote this bill. I wrote SB 482 to require that doctors and others consult the cure system before prescribing these powerful and addictive drugs. This tool will help limit doctor shopping. This is a little bit of patient shaming here. Break the cycle of addiction and prevent prescriptions from ever again fueling an epidemic that claims thousands of lives. Couldn't it also maybe stop over-prescribing? Couldn't it also maybe have more accountability? Doctor shopping. You know what would be really nice is if we lived in a country where doctor shopping maybe wasn't necessary in any sense, because we had an actual healthcare system that worked, not one where, you know, I mean, I've been using the Affordable Care Act since it's been around, and, you know, I'll be honest, compared to what we had, it has benefited me as a self-employed individual who is single and younger and male, because the rates are not evenly distributed based on gender. I can tell you that. It is way more expensive. Typically, it is way more expensive for a female than it is for a male. But for someone in my situation, the Affordable Care Act has helped me save money on health insurance. It has done that. The other side of it is I'm shuffled into different plans every frickin' year, because they change the plans, they change what qualifies, they change the insurers involved. So it's almost impossible for me to keep a doctor for more than 1 year. So chances are the next time I go to a checkup, and I like the doctor that I have, I want to continue going to that doctor. Chances are the next time I want to go, I might just have to pay out of pocket to get a checkup from the doctor I want to go to. So, you know, I think in some cases it might not be people doctor shopping, quote unquote, because they want to run a scam and get a bunch of drugs. I think it might be people doctor shop because they have to. Because they have to stay in a certain bracket to get health insurance they can afford, and all of a sudden it doesn't accept their doctor anymore. You see how dumb our system is? It is ridiculous. All right, so anyway, I think people make the mistake of thinking it's just for doctor shopping. Using cures, Dr. Renette Lev says this, using cures just makes you a smarter, better doctor. If you were a great doctor in the first place, you wouldn't need to be told to do this. You would, no, Los Angeles Times, I don't want your stupid newsletter. Well, I guess to kind of, you know, not be a total negative Nancy here, it's a good thing that this is a law now. It's a shame it has to be a law. And it's also a shame that they base it off of patient shaming. Instead of saying this is a way to fight the corrupt pharmaceutical industry, this is a way to fight corrupt overprescribing, which does happen. Look up no free lunch. Yeah, this is the first time I've ever heard of, quote, doctor shopping. But I have a feeling there's not much to it. I have a feeling it occurs maybe every great now and again, there's somebody that just wants to get as many drugs as they can, and they're trying to play the system. I'm sure that has happened. Just like I'm sure there is some voter fraud. I'm sure that every now and again that has happened, where somebody, votes illegally or whatever. But it's a small thing in comparison to the real corruption. The real corruption is election fraud and voter suppression. The real corruption is big pharma, evergreening, and the pharmaceutical industry. That's the real corruption. And I bet a lot of this doctor shopping isn't people trying to game the system. I bet a lot of this, quote, doctor shopping is people like me who have to get a different doctor every year. Because all of a sudden our insurance doesn't cover our last doctor. If you don't think our system is the most ridiculous thing ever, explain it to somebody not from the United States. Like, seriously, it's a fun exercise. I've done it before. I've explained it to friends of mine that are Canadian. I've explained it to my family over in Italy. And that was especially hard because we have a language barrier. My Italian is only so good. Their English is only so good. So we kind of speak together in a mix of Italian and English. Like, I'll speak some Italian, they'll speak it back. And then if I don't know a certain word, I'll try to look it up. We'll try to figure it out together. Explain the system. Like, they'll just be blown away by how dumb it is. They'll be like, well, wait, what about this? I remember I had a conversation with a friend of mine before who's Canadian, and like, it just blew his mind for the longest time. He's like, so it's like car insurance for you guys. And I was like, yeah, essentially. And at the time, this was before the Affordable Care Act, so there was nothing requiring people to buy it. And he's like, but you don't have to buy it. And I was like, yeah, technically you don't. And then I was explaining how, like, employers gave it. And he's like, your employer gives it? And I'm like, yeah, sometimes. He's like, what if you're self-employed? And I was like, you're shit out of luck, man. You got to buy it yourself. And then he was like, because it's a product, which that just blew his mind. The fact that we made a consumer product out of healthcare. Because, that's not only morally disgusting, but no other industrialized country does that. And he was like, he said, he actually asked a very interesting question that admittedly I don't know the answer to. And he's like, so, in the case of car insurance, if you like destroy your car on purpose or you destroy your home on purpose and they know that that's what you did, that's a type of fraud and you're not entitled to your payout, right? Because you're trying to scam the company into giving you money. So what he asked me, he's like, if you try to commit suicide and you survive and they know that's what you tried to do, are you denied any money from your insurance company? Because I guess if you're insuring your car and you destroy your car, I guess you're insuring yourself. You try to destroy yourself on purpose. So he was like, if you try to commit suicide, do you not get any insurance money from the medical care you would need after that? Which is very, very, and I kind of laughed a little bit. And his other friend that was with him, who was also Canadian, was like, dude, that's so dumb. And I was like, no, that's actually a valid question. And I think that by asking that question, he's exposing how ridiculous our system is. Like, he's exposing how insane it is that we treat healthcare like this product to be gained. And I'll be honest, I think it depends on the policy. I'd imagine that you would run into at least a handful of cases where, and I would actually argue most, where the insurance company would try to deny you any claims if you tried to kill yourself and survived. I bet you that would happen. Because they try to deny claims all the time. In fact, their goal is to, when it first hits your insurance company, their first goal is, what can we avoid paying? What can we get out of paying here? That's their first priority. Cutting costs and giving you less than what you should get. That's why we pay more and get less than every other industrialized nation in the world. And the Affordable Care Act was like, we can fix this while still inviting the insurance companies to the table. No, we can't. That's like saying, hey, there's termites destroying the house. We can fix the house and keep some of the termites. No, you can't. No, you can't. Would you hire a pest control company if it said, our solution involves keeping some of the roaches that are here? We want to keep a healthy balance of roaches to humans. So we keep some of them. Would you hire that company? I wouldn't. All right, I think I threw enough metaphors at this. You guys get the idea. Thank you for sharing that piece. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your news on with Ron.